Hey guys, John Adamson, the Rehab and Documentation Guru. Having a day that's kind of like the weather, a little bit, a little bit dreary. Um, but I wanted to talk about a case study today, and I certainly do not feel like I'm the most qualified clinician out there. And so, if you have any thoughts or suggestions on this, any comments, feel free to make them. I'm just going to tell you what I'm doing with this patient and go from there. So, to not give away one specific HIPAA violating piece of information, this is an elderly lady. Let's just say she's of advanced years, living on her own, very thin, never had any complications in the past, and she came down with CHF. Sorry, I'm getting messages. She came down with CHF, went in the hospital, treated, came out, was evaluated by me or case opened by me. And then I could tell something else was still going on, and I kept urging her to go to the hospital. Well, sure enough, she went to the hospital, and they pulled off 1,300 cc's from around her heart. And so anyway, they treated her. She's doing a lot better. And this is what I found out today. Her 30-second chair rise was nine repetitions, which for her was age normative. Her Tenetti without device was 25 out of 28, which again is age normative for her, and it's still a low fall risk, so it's really good. But she's got, this risk for, and nothing was going on cardiopulmonary wise. I mean, she's a little tachypnic, but blood pressure, heart rate, pulse oximetry, they all looked good with activity and without. So she's got general deconditioning, and if you've been to my course, you've heard me talk about the fact that Medicare does not pay for general conditioning in the absence of a complicated medical condition. And so this lady just got out of the hospital with CHF, and that's a medical complication, and it's a complicated one. Medicare recognizes this. So with that said, I know she's got to build up some general endurance, but she's walking around her house, she's doing stairs. Not safe to go out on her own just because she could really decompensate fairly quickly. But she doesn't need me very often at all. So what I did was I put her on a 1 week 4 orders, and I don't even think I'm going to need that. And I gave her some home exercises. I gave her parameters to safely and effectively follow them. She had a caregiver there. I told him the same thing. And I'm going to go check her in a week. I'm going to see how she's doing. If she's doing the exercises, it looks like she's making gains, and she's still staying, at this point, medically stable is what I'm guessing. Then I'm going to discharge her, and that's about it. So sometimes we get these patients who have just a general conditioning issue. And because Medicare doesn't cover it, we have to ask ourselves, well, if it's general conditioning, do they have a complex medical situation that necessitates me being involved? If this lady with CHF had shown me that despite being generally deconditioned, she also had out of whack blood pressure, heart rate, pulse oximetry, breathing response, then I better be the one that's supervising a program with her to make sure she doesn't decompensate. But that wasn't the case with her. So I'm going to cut her loose pretty soon. So anyway, just a case study. If you've got some case study suggestions, feel free to comment. As always, like and subscribe. I'm getting towards the threshold where YouTube will recognize my channel for commercials. Aren't you excited if you follow my channel? And of course, that'll help for the time that I put into these, because some are more timely consuming than others. This one's not bad at all. But anyway, that'll help me potentially in the future to keep putting out content. Anyway, take care. God bless. Have a great day.